Okay, but just remember, it is time to learn a new truth about taking your health back with Dr. Stephen Grable. He's an MD, naturopath, functional, integrated, holistic, all wrapped up with an MD that helps you become your own medical detective. Today, we're talking about the root cause and what to do about it of stress, anxiety, and insomnia. And so if you're ready to learn and grow in the classroom, because the doctor is in the house, fasten your seatbelt. We're going to learn and grow together. We're going to mute our mics, and it's time to dance. Here we go.
The Lillian McDermott Show.
We love, we fear, bridges we burn, we make mistakes, then we live and learn. When life gets tough, and it seems like your best ain't good enough. If you're in need of hope, you know where I'll be right here, right here. And when you need a friend, you can count on me. I'll be right here, waiting for you.
This is the place you can always turn to when you need a friend. The Lillian McDermott Show. To reach out to Lillian, visit her on the web at whenyouneedafriend.com. Now let's all learn together. Here's Lillian McDermott.
Hello, my listening friend. It's so nice we can meet each other on the air on this best day ever. And also, all of you who are watching on Facebook Live, I want to welcome you. Make sure you share it. Tell your friends about this because the topic today is going to be very important. They're all important. And when you're in the classroom, we learn and grow together. Please know that this is a safe place where you can go to when you need a friend. It is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friends, will feel empowered to embrace a new truth and live the life of your dream, your best life naturally. So once a month, I get to share the needle in the haystack, the pearl that we find in I guess the oyster. All of a sudden I'm going, where do pearls come from? So that's what happened when I discovered Dr. Stephen Grable. I was so thrilled, and I'm thrilled every time because, we get doctors that are from all over the world, but we may not be able to go to them. So my show used to air in Jacksonville, close in Florida. To be able to find a doctor that I would want to go to and trust, functional, integrative, holistic, alternative, whatever you want to call it, all wrapped up into an MD, traditionally trained, but decided to go outside the box. You can find him in Jacksonville Beach, and I want you to fall in love with him just as much as I have, because today we are talking about the root cause and perhaps how to shift and how to turn and take your health back when it comes to stress, anxiety, and insomnia. And since it is our sole purpose in life to give and receive love and knowledge, I'm so grateful that Dr. Stephen Grable is in the classroom. Welcome back, Dr. Grable.
Thank you. Thank you.
Yes. Okay. So here we are. You are the founder of Complementary Care Center in Jacksonville Beach, Florida. Mm-hmm. And people from all over come to see you because you offer solutions. So let's talk about you're classically trained as an MD. Right. What made you step outside the box and say, this isn't working?
Well, medicines have their place, and I prescribe medicines when needed, but, we try to avoid them if we can. So I did conventional for 5 years, many years ago, and I felt that just throwing drugs at things wasn't the answer.
Yeah.
Docs today, they'll listen for maybe 7 minutes, and then they pull out their prescription pad, which means the visit's over. So functional docs, what we do is try to figure out what the underlying problem is and try to help get it fixed with lifestyle change, nutrition, herbs, maybe some homeopathy, that sort of thing.
Mm-hmm.
It's funny, I got patients in their 80s, they go to the ER with a broken arm and they say, "What drugs are you on?" And they go, "None." And they go, "None? You've got to be on some drugs." And so, but I give my patients credit. They're the one who's doing the work. So it's a lot of fun. I read incessantly. It's really a joyful thing. And we have our portal set up, which I clear my message board every morning. So a lot of interaction with my patients. So it's great.
So you would be able to see somebody, for example, in Australia. We have listeners in Maine, Australia. Where else are you guys listening from? For those of you who are joining us live at Lillian's radio show on Facebook Live. So I would love to hear. So can you do like a Facebook chat or not a Facebook Zoom chat like we're talking today? Where
we could. It's not something that I've done to this point, but I feel quite comfortable in doing that. And
very good.
Set that up for people that are interested.
Yeah, they can have an insight to Dr. Grable.
A trip from Australia, so
yeah, they wouldn't be able to come in one day and leave the same day. Right. They would come and stay there the whole time because there's a lot of different modalities that you offer that other doctors don't. Like last time you were on, and for those of you who want to go to my YouTube channel or on Facebook, you'll find Dr. Grable. We talked about chelation the last time, and the first time we talked about Asira. There's so many different modalities that you use to get to the root cause. So when we chose today's topic, anxiety, stress, and insomnia, I didn't make the connection. And as I'm doing my research, as I'm getting ready for today's show, I'm thinking, which comes first? This is like the chicken and the egg kind of question.
Very, very good.
Is it insomnia? Is it stress? Or is it anxiety? So where do you want to start, Dr. Grable?
They're all tied in with each other. And so I think a couple of definitions I think might help the listeners. If you read Hans Selye, he was the S-E-L-Y-E. He was a guy who originally wrote a lot about the stress response and this sort of thing. And technically we should probably say distress because we all need some stress in order to feel comfortable and whatnot. If you were forced to just sit in a chair and do nothing, that would become distressful. So we need, a certain amount of interaction and things going on. It's our response to those stressful events is what causes us to feel emotional upheaval. And so in preparing for this, there's a really nice website called Self-Hacked. If you guys ever want to, Joe Cohen's site, he puts a lot of work into his stuff and had a real nice course on insomnia. And there's a lot of research being done looking at what's called the HPA axis. And that stands for hypothalamus, pituitary, adrenal. And I imagine a number of our listeners have probably heard these terms before. But they're closely tied in with stress and with insomnia. Because when that HPA axis is not balanced because of stress or infections or whatever, we typically have increased inflammation. So inflammation is really the key word. So when we're not getting proper sleep, our body is inflamed. When we're inflamed, we don't get good sleep. So it kind of becomes a vicious cycle with people. And we'll go into more detail about some of the stress and insomnia and so forth. But I think that the HPA axis is kind of the basis for kind of getting a foothold on our discussion.
Okay, so this is where I find, as a life coach, as someone who interviews and does a lot of research, sometimes people get into this pattern and this cycle that is very comforting. It's a comfort zone. And I always say comfort zone can kill us. And many of us are willing, we want to feel well, but that comfort zone keeps us in this hamster wheel that keeps feeding the anxiety, the distress that you're talking about. And then we are active and our brains keep us awake at night. So that it feeds one another. So let's stop the madness for 1 second. Let's pick one topic, and I'm looking down at my phone here and I'm seeing anxiety. So let's start with anxiety, because it seems like everybody wants to hear about anxiety. And I wrote the book, ebook, 90-Day Challenge to Self-Love. And the reason I wrote this is I did a show. Back then there were shows, now they're classes. I did a show with Dr. David Baker Hargrove about anxiety and depression. And that week, Dr. Grable, person after person that came in front of me, my teachers, my students, they were depressed, they were anxious. And the show was actually about self-love. Mm-hmm. And he said something to me that was what promoted this 90-day challenge to self-love, which people can get if you become a subscriber, you'll get the free copy. And he said to me, people that are anxious and depressed have lost themselves. They've lost their connection to self. Now that's the emotional component to it. Can you add anything to that why people are in that anxiety, maybe the medical side of it?
Well, one of the authors that I've been studying is Aaron Beck. He's the one who discovered cognitive behavioral therapy back in the 60s. And he's got a professional manual that I purchased, and also a workbook for patients. And the bottom line of CBT, if you will, is that emotion is a result of thinking. Mm-hmm. So there's certainly other factors that I can discuss in terms of anxiety. If you drink too much caffeine, if your thyroid is overtreated, if you're not getting good rest, those can kind of prime you to feel anxious. But most people feel anxious because of faulty processing. Okay. So they're looking at their life events through a lens that is not serving them well. And so he has 6 different categories that he talks about. And you can guide me a little bit, because I don't want to get too technical and then people kind of get confused. No. But the bottom line is, if you distill all the stuff that he's talking about down to its just basic component, it really boils down to optimism and pessimism. Mm. And so in his work, he is teaching how to look at a situation from a more realistic or positive viewpoint. And there's gazillions of examples that people can have, phobias and things like that. So if you can begin to understand how it's your faulty thinking that's creating the anxiety, you work on that, and then the anxiety is taken care of.
So rewriting the program. So first it's a thought, that thought converts into a feeling, and that feeling converts into an action. We've talked about that all the time in the classroom. But here's the thing. You brought up pessimists and optimists, and I just created a meme, and I don't know when Ashley's going to be releasing it, but the pessimist only thinks about what's wrong. Mm-hmm. The optimist, well, not only, but goes to the worst case scenario. The optimist thinks of the best case scenario, right? Right. But then each of them, whenever I hear somebody that's a pessimist, they'll say, "Well, I'm a realist." Mm-hmm. So what is the real? Can we start rewriting what could go wrong, or being that Pollyanna where everything is just right, and look at the solution? How do we get from that feeling like everything has to be a negative thought to rewriting the program? What do you suggest for that?
So why don't we start with catastrophizing? So that's one of the things that he starts out with. So what that is when you focus on the worst possible outcome. Okay. So for example, let's say you feel a little tightness in your chest.
Yeah, it's a heart attack.
That could be, exactly. I mean, that could be anything. But our minds will tend to go to, oh my gosh, I'm having a heart attack. Now, I'm not suggesting that you just blow that off. You have to talk to a doctor. there's a lot of people, out there that, they'll go to the doctor, they'll get reassured that it's anxiety or maybe some chest wall pain or something, but they really have trouble shaking that fear that they're having a heart attack. And so if they come to understand that they are just really catastrophizing something that is actually non-threatening, that can help. Another example would be, and you asked about balance. So a good example of that is, let's say you're walking down a dark alley and you hear a noise. Well, you don't want to be Pollyanna, as you say, and just ignore the noise, because maybe there is some thug ready to, mug you. So you turn around to see what goes on, and you see a cat had just knocked over a lid or something and runs off. Well, a rational thought would be, oh, everything's fine. It was just a cat, and you can get back to baseline. Whereas someone who has faulty thinking, if you will continue to manifest that anxiety instead of allowing their rational thought to bring them back to a place of calm.
So where do we go with that? How do we bring that? Because, here we are looking at the, you're talking about the stinking thinking that people have talked about before, faulty thinking. And at this point, when I'm dealing with somebody with anxiety, they don't want to hear that this is their thought. How can we get them to that next level and say, okay, if it's not the thought, which everything starts with a thought,
right?
But let's say it's not the thought. Let's talk about nutrition. Let's talk about, stress and not sleeping well, or burning the candles at both ends. How does that affect along with the thought?
Well, if you have, obviously, if you're not sleeping, since you mentioned that,
mm-hmm.
then there are several things that one can do to get a better night's sleep. Most people are aware of, having a dark, cool, comfortable bedroom, good mattress, good pillow, that sort of thing.
Sleep hygiene, yeah.
But a couple of tips that are quite interesting. Even 5 lux of light, which is even a night light, is enough to stimulate your body to think that it's daytime.
Mm-hmm.
Blue light from computers. A lot of people will, right before bed, they're sitting at their computer. So there are filters that you can get. There's special glasses that you can wear. I have my desktop set up that after 4 p.m., it clicks into low light evening and then doesn't click back on to regular until about 6 o'clock in the morning. And you can find these apps online and download those. And
your phones come equipped like that now too.
Yeah, and you can get screens, little plastic screens you can stick on your cover. You can wear, amber glasses, that sort of thing. But these are things that people typically don't think about. Eating before bed is really, we should not be eating for probably 3 to 4 hours before we go to bed.
Mm-hmm.
Because food makes our body think that it's daytime.
Mm-hmm.
Probably one of the best things that can help with sleep, and I teach this all day long to my patients, is to learn to belly breathe. And I don't know if you've learned that technique or not, but we naturally do this as kids, babies. And for some reason, along the way, we're taught to, take a deep breath, breathe in your chest. Well, this stimulates the adrenaline sympathetic nervous system. If you ever watch somebody who's really nervous, they're like, like this.
Mm-hmm. So
belly breath is where you're sort of breathing out of your abdomen. So the way you learn this is you put your hand over your belly button, and when you take a breath in, your abdomen should go out, and your chest doesn't move. So it's a feel. It's kind of like riding a bike. After you do it a few times, you'll get it. So if you're laying there and your mind's going around, which a lot of people struggle with, if you lay there and you just belly breathe, you'll be able to focus in on something that's going to bring you calm.
Yes.
Because you can't not think about something. Like I use the example of, don't think about pink elephants, don't think about pink elephants, don't think about pink elephants, right? So you can think about pink elephants, right?
That's all you've been focusing on.
But if you focus on your breathing,
focus on breathing,
automatically shut off a lot of the other noise that's going on. So we haven't eaten for 3 hours before bed. If you're really hungry, one of the things that they were teaching in here is I'm looking at, you can use like a tablespoon of ghee and a tablespoon of raw honey before bed, and that shouldn't stimulate your body too much, and it can kind of satisfy some of those hunger pangs. But I know that we would have a tendency to want to eat something right before bed. So if you can go to bed with a relatively empty stomach, exercise, if you haven't done exercise to where you're physically tired, you're not going to sleep well. And so, of course, exercise and all that's a whole other topic.
Yeah.
But to me, the key is just get your body moving. Most people need about 8 hours of sleep. A little tip, your best sleep is between 10 and 2. So that's 10 p.m. to 2 a.m.
Mm-hmm.
and 10 a.m. to 2 p.m. So if you can get to bed before 10 p.m. and at least get 4 hours, you can function on that. You may not be at your peak, but it's a heck of a lot better than going to bed at 12 or 1 and waking up at 3 or 4 and then trying to get through the day, because you're just going to be just dragging and you're not going to be doing well.
Yeah, there is a book called Change Your Schedule, Change Your Life. And it has to do with the circadian rhythm of our body and the clock. And I've always heard, go to bed between the hours of 10 and 2. But it didn't make sense until Dr. Suhas, his name is Dr. Suhas Shirsagar, and he's coming back on the show the class, to be a teacher in the classroom. And so when I learned, Dr. Furman talks about how you want to be in catabolic. So by the time you go to bed, that's not the time to start digesting food. You
Right.
want your digestion process to be done so that the catabolic state is beginning around that time. And that's when each organ starts shutting down and doing all this detox. So if we're not getting those hours between the hours of 10 and 2, then that detox isn't happening. So
Right.
because of that, can that toxins in the body be creating that feeling of anxiety, Dr. Grable?
They could, the thing the way I sort of conceptualize it is, a lot of people, low sleep, not getting enough sleep can certainly contribute to stress and inflammation and anxiety. But I think it's probably a little bit more the other way around, that the anxiety is tending to interfere with the sleep because we're worrying about this or worrying about that.
Or we're eating very late to fill a void.
Very late, or we're eating a lot of carbohydrates at night. That's when people tend to snack on the simple carbs, which then can cause hypoglycemia in the middle of the night. So people that wake up, I'll give you a little tip.
Yeah.
A lot of people tend to wake up between 1 and 3 in the morning, and that's liver time in
Yes.
the Chinese clock.
Liver time.
You mentioned toxins. So if you have a lot of toxins and your liver is trying to work extra hard, guess what? It's going to wake you up between 1 and 3 because it's working overtime. So doing things to help your liver, which again is a whole other discussion, but that can help you to get a better night's sleep as well.
Okay, so we're briefly touching on different subjects so that we can maybe wrap it up at the end. And and for those of you who are watching on Facebook Live, if you have any questions for Dr. Grable, I will, if I look down and I see the question, put a Q on there because that's a question for Dr. Grable, and I will ask it. But if I miss it before we finish, we have two close. We have the close for the podcast, and then we continue on. Any questions that we missed, then we talk after the class is off the air, so to speak, with the podcast. So with that in mind, if you have any questions, feel free to ask the question. And if you feel that it's private and you don't want to be on the Facebook Live and write your question there, you can always text me at 407-373-5959. That's 407-373-5959. 5959, and then it'll be a private text, and that way I can read it out loud and nobody will know it's from you. So I always want to promote safety and privacy. And I know when we're dealing with anxiety, depression, stress, we think that we're alone. That's that thought again, the thought that we need to rewrite the program. And so in a situation like that, Dr. Grable, when people are feeling this anxiety, and how willing are they going to be to stop and breathe, or maybe not take that extra bite before they go to bed, because they're already feeling, these feelings of detachment, unworthiness, that there's no way they can get out of this. How are some of the ways have you been able to help your patients, balance their body so that they can get to bed on time, so that they can rewrite the program? How are some of the ways that you help your patients?
Well, there's an author, her name is Claire Weeks. She's was a medical doc. She passed on, but she wrote a number of different books on panic attacks. Mm. And one of the things that she teaches in there is what's called floating. And Beck talks about this in his book as well, where he says that people will have one of the faulty thinkings called emotional reasoning. That's the title he's put on it. Because it assumes that the more intense the anxiety, the greater the threat. See, fear is really the basis for all the stuff that we're talking about.
Yes, yes.
So if you've gone to the doctor and gotten yourself cleared, which I recommend, because I don't think it's a smart idea to just stick your head in the sand and assume everything's fine. But most of the people are fine. It's all anxiety related, not some physical problem that's causing these things. You have to understand that, like you said, it's extremely common. I mean, I see stress anxiety all day long with my patients. One of the keys is not to fight the feelings that you have. In fact, one of the best techniques is to really close your eyes and just feel what you're feeling. So you might say, okay, I'm kind of sweaty, my heart's racing, I may feel like I'm not quite there. All of these are totally benign. None of these things are going to hurt you. You're not going to run up and down the street naked. Your head's not going to explode. Nothing bad is going to happen. And we all experience little bits of anxiety periodically. And if you don't suffer with anxiety per se as a disorder, you may have a day where you say, I'm just feeling anxious today. And you just kind of go, it'll pass, which it does. It kind of builds and it goes away and you're fine. But if you've suffered with an anxiety problem or panic, you tend to kind of magnify and you focus and it's like, oh my God, what if this doesn't go away? What if it keeps getting worse? And that just kind of makes it worse.
Okay.
So learning to
it's a story in our head. It's the story that we tell ourselves. It's a story in our head.
It's all here. It's all fear.
It's the voice. And
so, yeah.
Who's the voice? What's the voice?
Well, the voice is generally experiences that we've had. For example, let's take panic. Sometimes there'll be a trigger, maybe a bridge, a height.
From our childhood.
Closed spaces, something like that. That'll set sort of a little loop up in our brain. So when we're faced with that stimulus again, maybe going over a bridge or getting into an elevator, something like that, that triggers that little loop to start playing. So by learning to float through these things, belly breathe, I'll give you a couple of supplements that you can write down that I've had success with. Inositol, it's a B vitamin, and it tastes like sugar, which is nice. So get the powdered form. It's a lot cheaper than capsule. Okay. And you can use anywhere. The concentration of the powder is pretty uniform. So anywhere from a quarter teaspoon to a full teaspoon, 2 to 4 times a day, can do wonders. There's actually some good clinical studies on inositol and helping to calm down anxiety. Mm-hmm. And then another one of my favorites is theanine or L-theanine. And I usually dose 1 to 200 milligram 3 times a day. 9 times out of 10, those two things work wonders. Patients come back the next visit and they're really much calmer. And then when you're feeling calmer, then you can begin to apply more of the techniques about getting your thought processes in a better place.
Mm-hmm.
I'll share a personal example of this. Years back in 2011, I had I got to know the IRS very well. We won't go into any detail about that. But needless to say, that was a little bit anxiety producing.
Sure.
Well, once we had it mapped out in a strategy, and now it's all ancient history, it's been taken care of, my stress level went like this. Well, what changed? It was here because I still owed them some money and I still had to work things out. But once I had a path, we got that figured out, and then everything was fine. So it was all here. It wasn't out there, and, we can come up with all kinds of examples of this. But again, it's learning to look for the silver lining. Ask yourself, what is the positive part of the situation?
Yes.
That I think that can really help a lot.
Yes. Okay. So I have a question from Barbara.
Okay.
And Barbara wants to know, she says, I have been on meds about 17 years, but felt they never helped me. That's because it's a one size fits all. And we're all uniquely created. That's my own personal side note there. I am drug-free now and try to deal with the anxiety myself. Do you think it's wise to deal with it on my own? That's the first question. She also wants to continue talking about the recommendation of the inositol and the L-theanine. So let's go, because here's the thing. We put a lot of trust in this pill. Mm-hmm. My mom, okay, I was talking to you prior to getting into the classroom mode, and I was telling you how it was very difficult for me. I love my parents. Mm-hmm. My father is going to be 89. My mom is 86. My mom has dementia. My dad, both of them, you look at them, they're very healthy. My dad doesn't even look like he's 89. But they require so much help and attention. Mm-hmm. They have been great teachers on how to take care of my body now, so I don't have to deal with these things in the future. But as I was giving them their medication, not to judge it, I'm not judging here, I'm just making an observation. Mm-hmm. My dad and my mom were on the same dose. Mm. How could it be that my mom and my dad would be on the same dose? So let's talk about dosing and what would work for me, my DNA, my situation, how do you discern, Dr. Grable, who gets this and who gets that when I may not need a certain, how do you check your blood for deficiencies? Because that's basically what's happening, right? There's a deficiency.
Well, Linus Pauling said all disease can be traced back to mineral deficiency.
Okay, let's tell me more.
I've not read any good studies about anxiety per se being linked to a specific nutritional deficiency. One of the things I wanted to just address to you, Lily, is there's a good example of, as you were talking about, your parents are sort of like your kids now. Yes. And probably none of the listeners out there have kids. Yeah. And I think it's important that we learn in life, whether they're friends, family, kids, what have you, is we do what we can to help and assist, but everybody's on their own path. Mm-hmm. And sometimes people have to go through certain things on their path. And, we all want to kind of move all the roadblocks out of their way. And sometimes it's beyond our control. So if we're trying to control things that we can't control, that can be very anxiety producing.
Sure.
So getting to a place of acceptance a lot of times is very, very helpful. Mm-hmm. Your question about dosing, what I teach, because I deal with a lot of homeopathy and nutritional things, these are very safe. There's a very wide margin of safety. So I tell my patients to listen to their bodies. Your bodies are are processing 200,000 bits per second, which is incredible to think about.
I know.
So say inositol, for example. So let's say I recommend, okay, so you start at a quarter teaspoon twice a day. Then you get out a couple of days and you go, that's not really helping me. Well, maybe go up to half.
And I would say ask others, because I might think it's not working for me. And then somebody that's watching me and deals with me all the time says, there is improvement here.
Mm-hmm.
So
right. Yeah. Certainly get feedback from others.
Yeah.
But if you feel like you're not there, then you could increase it to, half a teaspoon 2 or 3 times a day.
How much time?
You could just kind of gradually go up.
Yeah.
Probably if you were at a full teaspoon 4 times a day and you're not seeing results, either that's not working for you, or maybe you're not perceiving that it's helping you, or maybe there's something else going on. Theanine, I've never read doses above 200 milligrams 3 times a day. Because it's an amino acid, it probably could be dosed at much higher doses. But again, if you got up to that top level and it wasn't doing you any good, probably maybe look elsewhere.
Okay.
What's going on.
Okay.
That answers your question.
And it could be a combination of many things. It could be toxicity. We talked about that last time you were on. It could be, some form of, mercury. It could be, some point metal in your body.
Well, that's why I like my Asara machine, which is sort of a biofeedback device. It runs 5,000 tests, and then that gives me a lot of good, useful information about how to guide patients and show them what to do. Mm-hmm. So, the problem with the one size fits all, unfortunately, that's conventional medicine these days.
Correct.
They make a diagnosis and they put you in a little pigeonhole, a little ICD-10 code, and they see what little drug box pops down. And they start with drug 1. If that doesn't work, then they go to drug 2. Now, a lot of times drug 1 will do the trick and patients will feel better. But, those are chemicals that we're putting in our body, and, that can cause other side effects and problems.
Sure.
And so if we can get these things addressed without resorting to chemicals, I think that's always a better approach.
Very good. And I just want to add, because there's so many teachers that we've had on the show and in the classroom that talk about mental health. Dr. Mensah, Dr. Albert Mensah is one that I want to highlight right now. There's a condition that he's an expert in. It's called pyrrole disorder. Have you heard of that, pyrrole disorder? Oh my gosh, of course you have. Do you want to talk about pyrrole disorder? Because that's how I met you. We were in that same meeting, and Dr. Walsh, Dr. William Walsh, who has been on the show, in the classroom, he talked about pyrrole disorder. Would you like to talk about that real quick? Because that symptom is anxiety.
Yeah. There's a great book. Your audience may want to write this down. It's called Mental Health Nutrients by Carl Pfeiffer, MD, PhD.
Yes. And
Carl was a very brilliant guy. He's passed on now, but he was a lot of the one that talked about the cryptoperols, which are typically, if you have pyroluria, I can't pronounce that. Usually it's like a B6 zinc deficiency.
Yes.
Zinc. And I see it. My patients today on the Asara, I saw B6 and zinc deficiency. So it's a very common thing. And that actually the B6 is part of an amino acid protocol used for depression. I use a couple of amino acids, vitamin C and B6. So, one could certainly try a little extra zinc or a little extra B6 safely. There are tests, there are companies that will test for these cryptoperols in the urine.
Yes.
And so you can diagnose that. And if they are out of whack, then you put them on zinc and B6. So,
yeah.
Again, I rely a lot on my Asara machine. So if I recommended zinc to somebody this morning. So I see that deficiency all the time.
Yes.
You can do blood testing for those too, which can give you information. They can give you clues about what's going on. So sometimes you don't have to spend, a couple $100 going to one of these specialty labs and having these tests done. So I would reserve testing for cryptoperols for a patient that we've gone through a number of different things and they're just not seeing improvement. At that point, then I say, maybe we ought to do some of these kind of tests.
Yeah. Yes.
Another thing is histamine. I don't know if you studied that at all, but too much histamine, too little histamine. Most people have heard of antihistamines. We know the histamine deals with allergy. Histamine is also a neurotransmitter. And if histamine is too high or too low, that can cause emotional issues with patients. And so that's
And
something that
how do you, I'm sorry, because I want to, I'm so sorry. When you have this histamine, how do you get that in your body? How does your body become, too much histamine or not enough histamine?
Well, a lot of it is genetics. Pfeiffer doesn't go into a lot of detail about histodelia and histopenia. There are some nutrients and things that are escaping me at the moment.
Okay.
Of how to get those in better balance. But I'm just putting out some things out there for people to think about, that histamine can be a factor.
Correct. Okay. So
that can be measured.
Yeah. Dr. Bill Walsh, his book is called Nutrient Power. I always keep it on top of my desk here. Mm-hmm. Nutrient Power, Dr. Mensah, and the lab that you were referring to is DHA Lab. And we've had many classes in the classroom with DHA, Dr. Albert Mensah, and of course, we have a Dr. Stephen Grable. And before we keep going, because I do want to mention, Dr. Grable is a sponsor. He has stood up and he has said, I am standing with you, Lily. I believe in what you're doing. And which is, we're taking our life back. We're taking our health back. Well, how do we do that? One step at a time. There's that great philosopher Meatloaf that sings the song, I would do anything for, fill in the blank, whether it's love, health, mental, emotional stability. What is it that you would be doing everything? You would do anything for, fill in that blank. But here's the what he says after, but I won't do that. That's not what we talk about here. We talk about, what are you willing to do to get beyond that, whatever a diagnosis, right, is a symptom, It's your body speaking to you. What is it saying?
Right.
And many of these things that we talk about here in the classroom is about listening to your body. And that's what Dr. Grable is talking about. So I want to encourage you, beyond today, if this is the first time that you've entered the classroom, I want you to register. Go into become an enrolled student. Register at whenyouneedafriend.com, subscribe, and the lesson will come to you. The class will come to you, whether it's on YouTube or when you go to whenyouneedafriend.com, you can click on any of the icons. Like me, subscribe, share. That way the classroom will grow. And while you're at it, one of the most important things is for you to click onto my sponsors link. All the information of my sponsors are there. All the information of everybody who's going to be in the classroom, what time, when, the topic, is all there, all linked to their site. So that's a benefit of subscribing. But go and check out, how can I support these sponsors that are supporting this classroom? Because you don't hear about this in the mainstream media. So let's work together. Let's form this group of empowered, responsible individuals, so that you too can become, take your life back. And so I want to highlight, Liberty Health Share, Keep Me Safe Organics worldwide, that has zero chemicals, zero toxin, all organic, and you get 10% off when you buy from my website. We have First Alternative Care, $35, no matter where. If you like to travel, you get telemedicine 24/7, and you're able to get dermatology, family practice, and 3 hours of mental health counseling a year for $35 a month. So that's for the entire household. These are sponsors that are standing next to me. Of course, the pharmacy in Merritt Island, mention my name, you get 20% off your entire purchase, the first order that you make. And then, of course, Dr. Stephen Grable, that you can go to Jacksonville Beach, and he is there, right there waiting for you to help you figure out, what is your body saying to you. That mainstream medical, traditional medicine, call it a diagnosis. So I want to encourage you to call if you have any questions for Dr. Grable. That's 904-247-74 55. And you can also go to his website. What is your website, Dr. Grable?
It's drgrable.com.
drgrable.com, and you're able to learn about all the different modalities that you can choose. And it is about choice, isn't it, Dr. Grable?
Mm-hmm. Yep.
So when I was talking, and I was watching you nod your head, our body is constantly speaking to us. That is our body speaking to us about something is wrong. And the doctors like you that have come on into the classroom to be our teachers have said 99% of illness is due to past trauma. Let's talk about how stressful it is to ignore that past trauma in our life, that we refuse to deal with it because we know it's going to be painful. But we drag it around for 20, 30 years.
I'll tell you, it's really interesting how, if I want to say relatively easy, but you may be surprised that you can let go of things. It's really a decision, whether it's forgiveness, whether it's, and especially with yourself, a lot of people going around with the little guilt cans dragging behind them, because there's a great book. I don't know if you've read Heal Thyself by Peter DeWitt.
No.
That is an excellent read. And he and two other MDs, they're talking primarily about cancer, but they really extrapolate that to most illness starts with emotion. And I think they're on target.
Yes.
So it's Peter DeWitt. It's like Diewet, German name. If you go on that, you should be able to find it online, or just ask me, Lillian, and I'll get the exact spelling. But it's called Heal Thyself, and you can find it on Amazon. But that's really a great read, and I couldn't agree more that letting go of the emotions. One of the concepts that's helped me a lot personally is learning to just look at life objectively. And I use the analogy of going to a movie theater, and you're sitting there in the seat and you're watching this movie. You're not in the movie, you're just watching the movie. And you get done, you walk out and go, whew, well, I'm glad I wasn't in that thing.
Yeah.
Well, you can do that. You can learn to do that in life. So let's say the kids have just had a food fight in the kitchen, and you walk out and there's mashed potatoes all over the place. Well, you can get all upset and angry and stew for 3 hours and scream and yell. Or you can say, oh.
Clean it up.
And then you go about it like you would brushing your teeth. Now, obviously, you have to discipline your kids or whatever is appropriate. But, when we get up in the morning, we don't sit there and fret about brushing our teeth or taking a bath. We just do it. And we, fixing our breakfast, or, we have certain things we just do methodically. Mm-hmm. And if you can look at things like that, like if somebody's sitting there reading you the riot act, you can kind of like they do on the, those where the camera moves back, and you can just sit there and just observe the person. You don't have to engage with them in that. Carolyn Mace, I think we've talked about her before.
Yeah.
And I know you know who she is. She talks about not giving away our power. We give away our power to people and circumstances. And I just say, make a game out of it. Just have fun and not let people and circumstances steal your power. Mm-hmm. Because you'll find yourself that all the anxiety and all this stuff will just start to diminish, and you'll feel better. We sit there and we stew about stuff. That's what just, eats us up.
Yes. So. And I want to add to something you said about the theater and the movie that you're watching. Even though we're watching a movie, and this is how important thought is, and we need to understand the brain too. The brain doesn't understand the difference between fact or fiction. It just knows what the thought is. The thought drives the engine. And so if we're watching that movie and we're hooked in there, our brain goes through the emotions of that movie. I remember watching it, and this is like the depiction of how we get sucked into the emotion of it. Because I used to watch my dad. My dad used to love boxing. And I would watch my dad as a kid watching boxing. And which, by the way, I don't, I'm not saying that you should watch boxing. But I remember my dad watching it like this. He was like in that. He was in it to win it. And it's like he did not his body responded to the moves, the blows, to the, oh my God. And he'd get upset if the person that lost. And I'm thinking, he's not even in there. Can you imagine? What we do to ourselves, our brain doesn't know the difference. And whatever we focus on, and it became clear with me, we can focus on what we don't want. And people are really good at what they don't want. But when you focus on what you don't want, whatever is the word after the don't, like I don't want to get a divorce, or I don't want to be unhealthy. I don't want to be, think the opposite of it, because whatever we're focusing on, that's what we will manifest more, right?
So take that example that you gave about the movie. So let's say you've just watched a horror movie.
Yes.
You're like this.
Yeah, I don't watch those.
when you leave, your brain starts to kick in.
Yes.
And you start to think rationally. You realize it's just a movie. There's nothing, it's not going to happen to you. And things just calm down and get back to baseline. I'll tell you a tough one for me. I'm a Gator. If I'm watching my Gators lose, and I'll sit there and the game will be over and I'll just be stewing, and then I'll think, wait a minute, it's just a football game, for heaven's sakes, and I'll go through this thing because I don't want to spend the next 24 hours stewing about this lost football game. So there's all kinds of examples like that. One thing I want to, if I could, real quick, couple of real pearls for the listeners.
Great.
With the adrenal, we talk about the HPA axis.
Yes.
Is there, you can do these adrenal saliva tests. And a lot of these you can do through companies online. You don't even need a doctor's prescription, where you measure cortisol at 612, 4 samples over 24 hours. That can really give you a great idea about where you are with your adrenal glands. I've had people that have just been flatlined. I've had people that have been very low, and that at bedtime their cortisol skyrockets. So that can really clue you in. And then the other little tip is to look up the term adaptogen. So things like ashwagandha, rhodiola, Siberian ginseng, there's a whole slew of them, can help to balance your system and help with balanced cortisol, help with what's called GABA, and a variety.
I was just going to ask you about GABA.
Transmitters. These can really be wonderful. Phosphatidylserine can help to lower that evening cortisol. So if you're one of these where your cortisol, you can tell by people that say, how are you during the day? Oh, I'm just exhausted, all day. But I'll tell you, at nighttime, all of a sudden, I get this second wind, and I can't get to sleep till 2 a.m.
Yeah.
Well, likely your cortisol has shot up. Because what happens is, during the day, if your body is perceiving that you're under stress, your body conserves adrenaline. It conserves cortisol, thinking that there's going to be a problem coming. Well, let's say the day goes along, just an average day, nothing really bad. In the evening, your adrenal glands relax and say, oh, okay. And so it'll start to dump all this cortisol, which is what's going to keep you up and keep you awake. Phosphatidylserine, that can help to balance that out. So those are a couple of little pearls that you could do.
I love these pearls, and I want to talk about these pearls after we finish the broadcast today through podcasts. I want to address some of the questions that are on Facebook right now that people have questions, because the spelling of that was like, what was the name of that again?
Sure.
Yeah. So I want to make sure that we get like a little bit of, because supplements do help. There's a deficiency. And like you said, there's those minerals. There's also the supplements that are out there that people can take. And nutrition, we didn't even tap into nutrition and how important a whole food plant-based diet is, and eating things that are whole instead of processed in the standard American diet, because that will deplete the body as well, right?
Yes.
Yeah, so we'll talk a little bit about that once we're done. But I want to encourage you, for those of you who would like to learn more, Dr. Grable is the founder of Complementary Care Center in Jacksonville Beach, Florida, and you can call him at 904-247-69 7455. Dr. Grable, if people wanted to email you or get a hold of you because they saw you today, is there an email that you'd like to give or?
Sure.
Okay.
They can drgrable18@gmail.
drgrable18. We'll repeat that in a little bit.
Yeah, I'll be happy. If you have a question or something, want to get a hold of me, that'd be fine. I'd be happy to do that. I type and
absolutely.
I can handle that.
Absolutely. And remember, we're in choice. We're going to continue talking afterwards, but we're in choice. Let's choose health every time. Please remember, I'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott and Dr. Stephen Grable wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Yay. Hold on.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.
Wonderful. You know, when we are seeking and our body is speaking to us, we want solutions. You know, first we talked about the pessimist and the optimist, but to me, a realist is someone who focuses on the solutions.
Right.
And considers. And Tim Ferriss is really good for fear setting, and that's a great teacher for fear setting. I would love to have him on into the classroom. But when it comes to supplements and minerals, you had mentioned a few of them. You mentioned inositol, L-theanine, and you mentioned also vitamin C. Vitamin C is a great histamine, for people,
and it also
cancer fighting. Yeah,
it reduces cortisol levels, which is important. Let me go down through a quick list here.
Yes, that would be good for those of you who are listening right now.
Okay, so
take out your notes.
A couple of points that I think is really fascinating is we have in our immune system we have what's called Th1 and Th2. And like yin and yang and up, down, black, white, there's a balance that needs to occur between Th1 and Th2. We don't need to get out in the weeds about what each of those are. But interestingly, stress typically reduces Th1 while increasing Th2. So that causes your immune system to get out of whack. And that can contribute to getting sick and that sort of thing. So these adaptogens help to bring those Th1 and Th2 back into balance. So the first one is ashwagandha, and that's spelled ASHWAGANDHA. And this can help with stress, tends to reduce cortisol, and also increases GABA, which is a calming neurotransmitter in our brain. Rhodiola, that's spelled RHODIOLA, helps to balance the HPA axis. So it can help with cortisol and help with the hypothalamus in the brain. Another one is...
But if that's not your issue, that wouldn't do you any good. Could it have...
Well, these are all these adaptogens, they kind of get their term from adapt, and you can tell if you feel overwhelmed. That's one of the questions I usually ask patients. If you really have a feeling of overwhelmment, because we all have those fluctuations in our day.
Yes.
And we don't have to act on every little single fluctuation. We drive ourselves nuts. But if you get to a point where life and all its challenges are just like, I don't put one more thing on my plate kind of thing, then that's a good clue that your adrenal glands are probably needing some support. And so these adaptogens can help. I would test them on my Asara machine. You can also have somebody muscle test you, which is a discussion for another day.
Yes.
Or just try them. They're not gonna hurt you.
So if somebody's adrenals are non-existent, maybe low, I don't know how you measure adrenals. So what would be, you're saying that these adaptogens would be good for the adrenals?
Oh, yes. All these would. Another one's called Eleuthero. That's ELEUTHERO. And one last one here is Schizandra, SCHISANDRA. that can help to balance adrenaline and serotonin. So there's other ones out there, but these are some of the biggies that have been studied extensively, have a good track record. I did want to clarify something. You asked about minerals, and I was mistaken. Magnesium deficiency.
Yes.
That and they've done studies in mice that can affect the HPA axis, worsen anxiety. So you can never go wrong unless you have kidney problems. You can always take a little extra magnesium. 200 to 400 milligrams at bedtime would be quite safe.
Mm-hmm.
And you mentioned vitamin C.
Mm-hmm.
And
so there was a question from Barbara, and she had said, do you recommend to be on a multivitamin B and C vitamin?
Well, I would have you look up, there is a product called Intramax, just kind of like it sounds, Intramax. And this is Drucker Labs. I learned about this 20 years ago. It has over 400 organically complex nutrients. This stuff's rocket fuel.
Really?
So I encourage everyone to at least give it a try. Yeah.
And this is a vitamin C or a multivitamin?
It has everything in it. And
really?
The only thing that besides that is a good blend of omega-3 and 6 fats. So those two things, the Intramax, and I like one called Body Bio Oil, those two things, that covers 97% of the bases.
Yes.
Then you can supplement with other things depending on what your needs are.
Yes. And yeah, magnesium. Hi, Jenny. Thank you for joining us. And Brianna, I'm so grateful for all of you for coming on today, joining us in the classroom. Let me see who else is here. And unless you write who you are and where you're from, I can't see where. And Barbara, thank you from Australia. I'd love to see where all of you are from if you haven't said where you're from, but I'm always glad to see you in the classroom. Today's topic about anxiety and depression, or we didn't even talk about depression. We talked about anxiety, stress, and insomnia. It seems to be so prominent out there that
Right.
do you think it's the lifestyle that we have adapted? We're like constantly on our phones.
Right.
We don't take time for ourselves.
Right.
We're constantly doing, and it's time for being. What is some good advice from not just you as an MD, but you as a person who, you've mentioned many times that, you've dealt with anxiety, or you've this is how you deal with certain things. What is your advice when it comes to just stopping and becoming aware that this might be something that I can slow down, or I don't need to do, or my yes and my no need to be powerful?
Yeah, we all have too much on our plates.
Yes.
I mean, it's crazy.
Yeah.
An hour before, you shouldn't exercise right before bed.
Mm-hmm.
3 to 4 hours before is fine. But we really need to just kind of start winding down. Very few of us really meditate that much. And meditation's just being quiet. You don't have to sit there and chant mantras or any of this kind of stuff. But, basically unwinding and, letting things go, the old let go, let God, depending on your spiritual belief system,
mm-hmm.
I think is very key. And, just be on a schedule. You should go to bed and get up at the same time every day, because your body, all your cells in your body function with a circadian rhythm. So they get used to a certain pattern. So if one night you're going to bed at 8 and the next night, midnight, that's going to be very difficult for
mm-hmm.
you to have any kind of a balance there.
Yeah.
So, let's say, to recap, you have a light evening meal. You should eat most of your calories earlier in the day. Light evening meal, finish up by 5 or 6. Be in bed before 10. An hour or so before bed, just start, winding down. If you want to watch some light TV or something like that, turn off the news, and maybe spend a little time meditation.
Yeah. Yeah. Barbara just said that she loves her meditation. We have Jason Stevenson here on the show in the classroom, and he is always so good with he does a little private meditation with us when he comes on.
Cool. Yeah. It's just, and really unwinding. If you're in bed 15, 20 minutes, you're not asleep, get out of bed. Don't lay there, and certainly don't sit there and look at the clock. Another thing that I forgot to mention is EMF, and this is a huge problem. So what I started doing a few months ago is I get all ready for bed, actually pull the sheets down, etc., and I go flip the breaker switch on the breaker box.
Excellent. Tell us more about that.
So much easier than putting screens up and all this kind of stuff. So that shuts off the power to the walls. So you don't necessarily even have to have any electronics in the room, but there's power lines behind your head, because most of us, the head of our bed is right next to the wall.
Yeah.
So I do that, and I also pull the plug on the router. So even though the router's in another room, you're still being affected by this. And I could tell within the first 10 seconds, the first time I did it was different. I could tell a different calm. So now that's a habit. I'll do that the rest of my life. And I choose a flashlight to get around, and it's really worth that extra little effort.
You can take your phone, because when you gave me that idea of shutting down the breaker box just for your bedroom, I live in an area, condominium. And so even if I shut things down, my neighbors upstairs or whatever, they're still, these EMFs are very powerful. Right. Lloyd Burrell, and he's coming back to the classroom at the end of the year, but Lloyd Burrell, his life was completely affected by electromagnetic frequencies, and he talks about it. But, yes, but at least eliminating the ones in your bedroom that are constantly assaulting us, that's a great tip. But for you, instead of using a flashlight, you could also use your phone on airplane mode,
right,
as your flashlight.
Right.
So there's just so many. It's that electronic world that we find ourselves in. We've become addicted to our phones. I know I'm constantly picking up my phone. Hey, what's going on? What's going on?
Well, we both know Lee Cowden.
Yes.
And Lee had a husband-wife combination that came down with different cancers at the same time. And their bedroom looked like an electronics store. And they had all these computers and routers and all that stuff. So they had to get their bedroom all cleaned up. And when they did that and they detoxed and stuff, their cancers went away. So EMF can actually cause cancer. That's how bad that can affect our nervous systems and immune systems and all that.
Yeah, there's so much we don't know. And I believe that one of the reasons I am so passionate, and I know you are too, because we have had marathon conversations about one thing leading to the other and to the other, but we don't know what we don't know. And I think that if we were to say to ourselves, I am my own best friend, I am the biggest love I will ever experience in my life. What can I do to support me? What can I do to love myself? And of course, the 90-Day Challenge to Self-Love ebook that you can get for free by becoming a subscriber at whenyouneedafriend.com is a way to start. It's a way to start loving yourself. But there are other things that are adding to the mix. And the more we chip away those layers, the more we go see doctors like Dr. Grable, you help us chip away at the layers. The better off we will ultimately be. And it's amazing how our world changes when we stop putting the priority over our phone or priority over, whatever is making us sick.
Exactly.
Yeah. And, we just need to continue these conversations and be proactive. One quick word of advice before we go, Dr. Grable, what would you say is the number one thing that we need to listen to when it comes to either stress, anxiety, insomnia, to start taking that step towards health?
I would say probably learning the belly breathing, because what that will automatically do is start to take your mind off of the stimulus.
Yes.
And you can just focus in. You can do that if you do it with your eyes open. You don't have to close your eyes. So if you're even at a stoplight, you can become aware of your breathing. In India and those places, they say, the prana, that, all disease can be cured through the breath. So just learning just to breathe and focus on your breath, that alone could do wonders. If I had to pick one thing, that would be it.
It does. It does. There's certain things that I've learned in the classroom. One of them is you can't be upset with a smile on your face. You can't have negative thoughts when you have a smile on your face.
Right.
And people must think I'm crazy when I go walking on the beach and I'm if I'm not smiling, my mind will go somewhere else. So a smile goes a long way for more than one reason. So that's one thing that I wanted. And then journaling. Journaling is just so powerful. Dumping what is in you and writing it down. And once you see it in the paper, and then you can maybe start doing something. Like if it's something that keeps coming up, and then that discipline, the discipline to, like you talked about, being on a schedule, doing things on time, and that breath, having the discipline to have that belly breathing where your rib cage expands and your abdomen expands, not your chest. If you find yourself breathing and your chest is going up and down, doesn't that cause stress right there? Isn't that like?
Well, that's stimulating your adrenaline system.
You had mentioned that at the beginning. Yeah. Yes, absolutely. Okay. So for those of you who have tuned in today, I want to thank you. Thank you for sharing this. Please tell your friends that this conversation is happening Tuesday, Wednesdays, and Thursdays. And we have Mondays and Fridays where we get to join the movies. We get to watch a movie of an old show that's played before, an old lesson that you can be part of the viewing party. So we're trying to get streamlined so that you know exactly when to go. Please subscribe, please share, please follow, please like, and most importantly, love yourself, whether it involves forgiveness. And Dr. Grable, we could just do a whole show on forgiveness, couldn't we?
Absolutely. Absolutely.
And that's what I love about you as a doctor. You're not just an MD. You really get to know and listen the other person. And I want to encourage you, if you haven't reached out to Dr. Grable, please reach out to him. He had mentioned that his email address is, what is it, Dr. Grable?
drgrable18@gmail.
I didn't even write it down, but I do have, it's drgrable.com. Go and check out all the different modalities. Worth the drive. I live in Cape Canaveral, which is about a 2-hour drive, 2.5-hour drive to see Dr. Grable with my eyes closed. I wouldn't even hesitate. So if you're in the surrounding area in Florida and you want to do a field trip, gather your friends, come from Australia with all your Barbies and whatever. I just insulted the Australians. So I'm so sorry. I'm so sorry for that. Just come and just be a part of what we're doing here, which is to create a change. So until next time, before I get into too much trouble, thank you so much, Dr. Grable, for your willingness to share your wisdom and empower all of us together.
Thank you.
Thank you. And to all of you, thank you so much. And I hope that this has been like a dipping your toe and learning some more. Until we meet again, we'll see each other soon.